Hello, my name is Janelle Wessels, and I will be performing the head-to-toe assessment. So first things first is I would check for my patient and the patient's order, making sure that the doctor did order us to do the head-to-toe assessment, and then the patient's name and date of birth. So I will go ahead and walk into my patient's room. I'm going to close the door behind me, close the curtain behind me to maintain patient privacy. I will perform my hand hygiene, and then I'm going to go ahead and put on my gloves. Okay, so at this point, I'm going to introduce myself to the patient. Hi, my name is Janelle, I'll be your nurse for today. I'm going to go ahead and do a head-to-toe assessment, which is basically checking from your head all the way down to your toes. Can you just verify your name and date of birth for me, please?
Mary Jones, June 1st, 1951.
Perfect. I'm going to go ahead and check your wristband here. This makes sure my two patients' identifiers are being met, so it matches the wristband. So first things first, I would ask my patient if she has any pain today. Mary, are you experiencing any pain today?
No.
Okay, perfect. So no pain. I'll go ahead and get us little vital signs. So vital signs are within normal limits. Her blood pressure is 120/82. Respiratory rate is 18 beats per minute. Heart rate is 72. Temperature is 98.4, and that's done through temporal. And her oxygen is 98% on room air. So now that that is done, I am just going to have her tell me her name and date of birth one more time.
Mary Jones, June 1st, 1951.
Okay, Mary, and where are you today?
Hospital.
Okay, and what is the month and the year?
June 2024.
Perfect. So at this point in time, I would say that my patient is ANO times 3. So I'm just going to look at her from a standpoint. She seems to be well groomed. She's dressed in the appropriate season and doesn't appear to be in any distress or anything like that. So we'll go ahead and start with the hair. We're going to go ahead and feel for the head, make sure there's no bumps, bruises, or any lesions, and that hair is evenly distributed, which it is. Then we will go ahead and look at the ears. So we're going to look at the left ear, look at the right ear. I'm going to go ahead and shine my light. Ears are intact. There's no leakage or any drainage. I will go ahead and look at the neck. Okay, I'm going to palpate her lymph nodes. I'm going to have her look back. Gonna feel for the trachea. So trachea is midline. Lymph nodes upon palpitation are not swollen or tender, don't seem to be inflamed or anything like that. I'm gonna check for jugular distension. There is no jugular distension. So I'm gonna go ahead and move on to the eyes. Gonna look with my light. Okay. Mary, go ahead and look at my pen. Perfect. So pupils are equal, round, and reactive, and accommodated to light. I am going to go ahead and look at the nose. So I'm going to feel the sinuses, make sure that they're not swollen or inflamed, which they're not. I'm going to go ahead and look inside the nose. It appears to be intact. There's no occlusions or no abrasions, no airway blockages in the nose. I will go ahead and look in the mouth. Okay, oral mucosa is red and intact. I'm going to go ahead and look at the eyes one more time. Open up for me, please. Okay, so sclera is white and conjunctiva is pink. And at this point, let's see, the eyes, nose, lips. I checked for defibrillar extension. Okay, we're gonna go ahead and take a look at the skin. So I'm looking at the skin. Mary, if you could sit up for me, please. Thank you so much. Making sure that I'm checking the bony prominences. Okay, go ahead and lay back down. Okay, so skin is dry and intact. It's warm. There doesn't appear to be any breakdown on the bony prominences. So now I'm going to go ahead and listen for the heart rate, okay? Okay, heart rate is perfect. It has regular rhythm. And now we will be going and checking the radial pulses. Okay, so radial pulse is 2+ bilaterally. I'm going to go ahead and check the pulses behind the knees. Okay, they are also 2+ bilaterally. I'm going to now check the pulses on the feet, the dorsal pulse. And they are also 2+ bilaterally. I'm going to check the capillary refill on the upper extremities on the hands. They are less than 3 seconds. I'll check that at the end. Okay. So now we're going to go ahead and listen to the lung sounds. So I'm going to listen to 6 parts on the front and then 6 parts in the back. Okay, Mary? Okay, if you can go ahead and sit up for me, listening to the back part. Okay, you can go ahead and sit down. So lungs are clear in all areas, both anterior and posterior. She doesn't have any labored breathing, and chest rise and fall is symmetrical. So now we're going to go ahead and just listen to the stomach. So first I'm going to inspect the stomach, make sure that everything seems to be intact, which it does. I'm going to go ahead and listen to all 4 quadrants. Okay, so vowel sounds are active in all 4 quadrants. Mary, I'm going to go ahead and just press down in those same 4 quadrants that I listened to. You let me know if you feel any pain. Did you have any pain?
No.
Okay, and when was your last bowel movement?
Last night.
Okay, perfect. So I am going to have you go ahead and sit up. We're going to check range of motion. So go ahead and have your hands up to the side and then in circular motions. Perfect. So full range of motion. Go ahead and put your hands like this and don't let me press down. All right. Okay, and I'm going to do the same thing with your legs. Go ahead and put your legs up. Okay, and then your ankles as well. So ankles, don't let me press down. And then if you can move them this way, your toes this up, toes up like this. Okay, and then down, and then around in circles. Like kind of like this. Okay, perfect. So ankles are have full range of motion. I will have you go ahead and walk for me, please. Okay, walk back for me, please. Go ahead and if you can touch your toes. Okay, I'm gonna push you. Don't let me. Okay, so patient has a full range of motion on her back. Her gait is stable, so there's no risk for falls that way. At this point in the assessment, I would say that her Glasgow scale is a 15. And if there was any teachings that needed to be done, I would go ahead and do them at this time. But Mary, thank you so much. That is the end of our head to toe assessment. I would go ahead and take off my gloves, perform my hand hygiene, and I would go ahead, leave the room so I could chart. Thank you.